everyone. Welcome to session 2 of the Health Center Association of Nebraska On-Demand Health Center Board Series. Before we get started, I'd like to reintroduce you to our expert consultant, Burt Waller. Mr. Waller has devoted 40 years to leading healthcare organizations ranging from large hospitals to small startup community health centers. Mr. Waller works as an independent contractor assisting HRSA with operational site visits and other technical assistance needs. So now I'm going to go ahead and hand it over to Burt. Take it away, Burt.
Jenna, thank you. In this session, our focus is the importance of documentation as well as suggestions to ensure the content of your board records is complete and is robust. Documentation of the board's work is very important. There's a standard maxim in medicine and healthcare, as well as in other fields with significant oversight and regulation, and it says, if it isn't documented, it didn't happen. The key to compliance during a HRSA operational site visit is your written documentation. Oral information is certainly collected by interview, and it's helpful, but it's considered supplemental or secondary to your written documentation. The health center is responsible for knowing what's required and providing the documentation that HRSA says must be made available to make a determination of compliance. After reading and reviewing board documents from more than 175 health centers, what I've learned is there's very great variation. Sometimes I'll ask the person involved in recording and maintaining the board records if they have awareness of HRSA's expectations and requirements for governance, and most often I'm told no. I also will often ask, where did you get this layout for your minutes, and how do you decide what to include? And the most frequent answer is, we're just doing it the way we've always done it. It's a best practice, and a practice I would encourage you to adopt, to be familiar with HRSA's requirements for governing board documentation, and to design your record keeping to accomplish its purpose. That purpose needs to include a clear record of attendance, presence of a quorum, and then indicate the engagement of the board. That engagement of the board should document discussions, the motions and actions taken by the board. It needs to demonstrate board engagement and the board exercising its authority over direction, policy, strategies, and priorities. Often when the board describes what's reviewed in interview, we find it's very different than what's recorded in the board minutes and records. It's really important that your records be robust, thorough, and encompass the engagement of the boards. Additionally, many boards now use executive sessions or closed sessions to conduct parts of their business. And when you do those things, you need to keep notes as part of your permanent records so that you can document what those actions have been, as well as your routine minutes. Boards receive a large volume of information. Sometimes it can be overwhelming. I encourage you to consider the best practice of evaluating the information you're bringing to the board and the presentations made to the board. Are they understandable to all board members? One of the hallmarks of health center boards is the diversity of the board. It can be composed of professionals in the fields of medicine, finance, education, all sorts of endeavors that are important for the success of the health center. But the majority of the board members are going to be patients of the health center. The question that you should ask and challenge yourself for is the information being presented to the board understandable to all board members? Think of the board members who, by virtue of background, education, work experience, are the least able to understand the information being presented. You need to ensure that it's understandable to them. You need to be sensitive to their need for information and ensure that all board members can understand all information. Further, you need to consider the information that's coming to the board in terms of the board's responsibilities. Oftentimes, the reports that are brought forward to the board are copies of management reports, and yet the roles and responsibilities of the board are far different than those of management. The board's responsibilities relate to ensuring that the needs of the service area are addressed through expanding access and through reducing barriers to access. The board's responsibility is to establish priorities, to establish policies, to evaluate progress in achieving goals, and to hold leadership accountable. You need to ensure, and it's certainly a best practice, to evaluate the reports and the information being presented to you and make sure they enable you to accomplish the purposes for which the board exists. Further, you need to ensure that the reports you receive, your consideration of them, and the directions you provide to the leadership of the organization demonstrates that you're monitoring progress toward goals and that you're focused on the priority areas that are established through your strategic plan and your obligations to HRSA. There's further elaboration on all of this that's encompassed in Chapter 19 of the Compliance Manual, Board Authority. And we'll be discussing those specifics in the next 2 sessions. We'll be working to ensure that you're aware of all the required board authority compliance elements. We'll talk further about the contents of your minutes and your records to ensure that they include documentation that discussion is taking place and the board members are taking an active role in the discussion of any significant issues. We'll challenge you to answer the question, how does the board use the information it receives to evaluate progress being made toward priorities and goals? Because if you can't determine that from the minutes, then you'll have difficulty with your operational site visit. I'm often asked, what's an example of really good minutes? Can you give me a set of good minutes? And so I developed this illustration as an example of a best practice. If you take a moment to look at the second one of these entries for minutes, you'll see that it's distinctly different than the first. It confirms that the board received the information in advance, allowing review prior to the board meeting. It includes documentation that everyone was reminded of the priorities that had been established by the board for its clinical services. It draws attention and focus to the indicators where progress has been less than expected. And because there's a notation of discussion and a request for follow-up information, it demonstrates that the board was engaged, that it evaluated information being presented, and it asked for follow-up action. The purpose of this is to ensure that you have an example of what represents the best practice of documentation showing full board engagement concerning an area such as your clinical services. When I work with board, there's some common questions that I receive. Is there a recommended format for board minutes? Well, there's no HRSA mandated or recommended format for board minutes. HRSA's interest is really seeing that the minutes are adequate for an objective determination of compliance with their governance requirements. And while this brief presentation has shared with you some of our suggestions for ensuring your board records, including the minute and the supporting report, as well as committee minutes, are thorough and robust, each health center should consider its own state laws and regulations and consult with its legal counsel in making decisions about its record-keeping practices. Another common question is, can the health center board use a consent agenda? Well, certainly the consent agenda is common in health centers today. It can be an excellent way to reduce the board workload, but be mindful that you'll still need to ensure you've documented the board's review, evaluation, and approval of any of the HRSA required specific items as identified by the Health Center Compliance Manual. Again, we'll discuss those more fully in the next 2 sessions. Familiar examples of specific approvals required of the board include periodic updates of the nominal fee, days and hours of operation, and any decisions directly impacting access to in-scope services. And a final frequently asked question is it acceptable for committees to perform some of the board's work? And again, committees are commonplace in health centers and can be an excellent means to reduce the workload of the overall board. Be sure your committees are functioning in accordance with your bylaws. Be sure you maintain a written record of the committee meetings, including attendance and minutes, and be sure that you're mindful of the committees reporting to the board. It's best practice for all board committee minutes to be included in packets, and that there are opportunities for the full board members to ask questions about the work of the committee. Now, I'm going to hand this session back to Jenna for wrap-up.
Thank you so much, Burt, for your expertise today on documentation. We are going to move forward and take a look at our next sessions. We have 4 additional sessions planned, and our next session, as Burt had mentioned, will dive into Board Authority Part 1. If you have questions, please don't hesitate to reach out to Mr. Waller himself or Health Center Association of Nebraska. Thank you so much for your time.